This video demonstrates some of the basic practices of sterile technique. Microbes and their spores are everywhere, on any non-sterilized surface, in liquids, and in the air. The purpose of sterile technique is to avoid contact between sterile cultures, tools, or materials and anything that is not sterile. This includes limiting the amount of contact between anything that needs to be kept sterile and the open air. Good sterile technique involves several basic practices. Wash your hands prior to and after performing any work with microorganisms. Any gloves worn should be clean and not previously used. Before and after working, wipe down the work surface with either 10% bleach solution or 70% alcohol. When sterile items are removed from their packaging, if some items are left in the package, reseal the package to maintain their sterility. Some microbiology implements come pre-sterilized and in sealed wrappers. Always open the wrappers of sterile pipettes, loupes, spreaders, or other such items from the non-working end of the item. Metal items, such as loupes, should be flamed immediately before use. Once implements have been removed from their sterile wrappers or flamed, they should be used immediately and not be allowed to come into contact with anything that is not sterile prior to use. To avoid contaminating your work surface, once materials and tools have come into contact with E. coli, do not place them onto your work surface, but in a waste container. When inserting loupes or pipettes into tubes, vials, or bottles, do not touch the sides of the container opening with the loupe or pipette. When transferring things to or from a container, use the following procedure. Have the loupe or pipette ready in one hand. Quickly remove the cap from the tube or vial you are transferring to or from. Some people remove and hold the cap with the thumb and forefinger of the hand holding the tube. Others remove the cap using the pinky finger of the hand holding the loupe or pipette. Whichever technique you use, do not drop the cap or place it down. Hold the cap facing down and keep your fingers away from the rim of the cap and tube. The openings of glass containers should be flamed just after removing the lid and prior to having pipettes or other implements inserted into them, and again before placing the lid back on. You cannot flame plastic bottles as they will melt. To keep contaminants from falling in, replace caps and lids quickly when adding or taking things from containers. When adding things to or collecting bacteria from plates, open the plate the minimum amount needed to perform the manipulation. This helps prevent contaminants from falling onto the surface of the plate. And finally, remember to remain conscious of and think about where your hands and any tools and items you use are as you perform microbiological procedures.